Hi, this is Dave here from Pro Sport Physiotherapy, and in today's video I just want to talk about plantar fasciitis. So you may have heard that term kind of spread around. It's it's a pretty common term to the non-medical profession, and what we like to call that actually these days is plantar fasciosis. Okay, so that we're finding now with a lot of these kind of issues is that there's not acute damage to the tissues, but it's more of an irritation of degenerative tissue. Okay, so that's something that you don't necessarily need to worry about the terminology, but it's always useful to know because those two terms will be spread a bit. Now, the plantar fascia attaches onto the calcaneus hair, and then it just attaches down into the bones of the foot. Now that tissue is very, very important as a shock absorption to absorb shock as the foot hits the floor, and also give the body valuable information about where the foot is in space. Now, sometimes if you're maybe carrying a bit of excess weight and you're not a sporting athlete and you spend a lot of time standing all day, then the literature suggests that that could be one of the predisposing factors for irritation of the plantar fascia. Okay, so some simple kind of changes to your workstation, or just some simple interventions can go a long way with that. Now, if you're a sporting athlete and your BMI is pretty decent, then usually it's a loading issue that tends to irritate the plantar fascia. So it's something where you've been training for a certain amount of time and volume and intensity, and then that might just spike a little bit too quickly, and then the plantar fascia might just get a little bit grumbly. Now that's all well and good, but we want to know why at Pro Sport Physiotherapy is why that plantar fascia on this side and not the other side, or the Achilles didn't get irritated, but actually the plantar fascia. Okay, and that's where we then will trace back through your injury history and find your particular compensations that may have happened due to previous injuries, or due to technique in the gym that you're using, or whatever your sports are. Okay, so that's the one thing I would say is, although the literature suggesting okay, it's either load or it's body weight for non-sporting athletes, every patient's plantar fasciitis or plantar fasciosis has to be treated individual to that person, because your compensation strategies now, when you've had previous injuries and you've had whatever had happened in your life, will be very different to the next person. And that's where we need to find the true drivers of what causes irritation in the first place. And again, that could be all ankle injuries, it can be all knees, it can be all hips that has subtly changed the direction of force going through the joints, and then the fascia at this particular point where it's sore may just be absorbing a lot more force. Okay, and that's where again you really need that specific kind of individualized treatment plan in order to get rid of this quickly. The bad news, unfortunately, is for a lot of people this can hang around for a little bit of time. Okay, so it can take quite a bit of time. It can take anyway, even up to 3 months and beyond. But what we find at Pro Sport Physio is if we find the true drivers of this, then we can stop excessive pressure on it. So we're not just allowing that tissue to relax again and settle down, but we're stopping that particular fibers that got irritated. Okay, the direction of force that's going through them, we can maybe change that with some subtle rehabilitation exercises. So that's why I said it's very important that we get the individualized treatment plan bespoke to you. So when you come into us, if we had 5 plantar fascia patients in, every one of them may have a different treatment plan. So we're not just going to give the same exercises to everybody. And that's important to understand. And that's why some exercise routines might work really well for some people, and then you try them and you've had no luck with them, because that may not be the stimulus that you need for your body. So it's just worth keeping that in mind. So as I said, that's the plantar fascia. The 2 big things obviously is reducing your load straight away, whether you're a sporting athlete or maybe having a look at your BMI and then having a look at your workstation as well. Okay, so I hope that was useful. If you have any questions, feel free to get in contact with us.